After 3 years, the WHO declared that COVID-19 was no longer a global health emergency. However, COVID continues to echo, and recently there has been an uptick in cases around the world. Thankfully, those cases are mostly mild, and people are getting the sniffles. But what else is out there? We asked Kamran Khan, practicing infectious disease physician, professor of medicine and public health at the University of Toronto, and founder and CEO of BlueDot, a global infectious disease intelligence company. Kamran, what's worrying you?
Well, thanks, Debbie, for that question. And, my general philosophy is not to worry, but to be well informed and well prepared. So let me start out there. But I do think that something that may not be readily on people's radar is that climate change is actually shifting the global landscape of many infectious diseases, notably those that are spread by insects like mosquitoes and ticks.
Yes.
Now, when we talk about climate change, we're often, talking about what might happen 5 or 10 years into the future. But I'm really talking about things that are happening right here today in the world.
Hmm.
For example, just in the past year in the continental United States, there's actually been 10 cases of malaria that were locally acquired. We
Wow.
think of malaria in the United States, and this includes the deadliest form known as falciparum malaria.
Wow.
Now, we see cases of malaria in the United States all the time. That's not unusual. It's just that they happen to be in people who have returned from other parts of the world where malaria is found. But what's
Mm.
very notable here is that these 10 cases are in people who did not travel outside the United States. So we're seeing this kind of reemergence of a disease that was here centuries ago, but is starting to make a bit of a comeback.
Hmm. Surprising.
Another important mosquito-borne disease is actually dengue. It's
Hmm.
found in many parts of the world, but it's also now starting to expand into new areas like parts of Europe and also parts of continental US. So actually just this past month, a case of dengue was confirmed to be locally acquired in a suburb just outside of Paris in France. So we don't typically think of acquiring a disease like dengue in that part of Europe. But also,
No.
there have been hundreds of cases confirmed locally in the United States in states like Florida, Texas, Arizona, and California. So,
Hmm.
it's important to note that that climate change is continuously shifting the landscape of many different infectious diseases that could seriously impact the health of travelers. Now, you asked me like what I'm worried about, but maybe I'll just
Yes.
say what I'm most concerned about. A few trends. First is that, most travelers are unaware of the health risks that they may encounter.
Hmm.
And so they're not well informed or well prepared. And I see this firsthand in my practice, people coming back from other parts of the world with serious and sometimes life-threatening infectious diseases that are preventable.
Oh dear.
The second is that today there are more and more people who are living with compromised immune systems. Our therapies for cancer, for example, have advanced, and people are living with these conditions longer.
Hmm.
People who have autoimmune conditions like Crohn's disease or rheumatoid arthritis are on therapies that help manage those diseases, but leave them far more vulnerable to developing serious and potentially life-threatening illnesses from infectious diseases.
Hmm.
And third is that, many of my peers, physicians and other healthcare providers really are just unfamiliar with how the landscape of infectious disease is changing around the world.
Hmm.
And so they're not optimally equipped to help their patients prevent some of these illnesses, or if they actually do develop those illnesses, to even recognize them quickly and to initiate appropriate treatment, because these are conditions that many of us haven't had training in or very
Hmm.
limited experience with. So these
Hmm.
are some important trends that I see that really emphasize and highlight why it is important for people to be proactive in protecting their health prior to traveling and to
Hmm.
be in close communication with their healthcare providers.
Hmm. That is absolutely so true. In what's become a very crazy world, and planning and doing your research is incredibly important. And Cameron, what advice would you offer people, given everything that you've just shared? What advice would you offer travelers who are heading out on their next trip on how to stay healthy?
Hmm. Well, let me start out by saying, first of all, it's so important for travelers to remain healthy, not just for their own benefit, but also their families. But at the end of the day, healthy travelers equals a healthy world and a healthy
Yes.
planet. And what I mean by that is disruptive outbreaks and pandemics happen when travelers inadvertently carry viruses or other types of microbes from one part of the world to the next. So
Hmm.
if we can address illnesses in travelers, we don't have outbreaks or pandemics. So this is how,
Mm.
your health, and we just learned over the course of the pandemic how your health is connected to the health of everyone
Mm.
else across the
Yes.
world. But let me start out by saying, as a physician who specializes in this area, I think the
Hmm.
first thing I would suggest to people is do your own research to better understand what types
Hmm.
of health risks you may be facing in the destination that you're going to, and consider that in the context of what your underlying health conditions might be. Maybe you have some other medical conditions that are very pertinent and may put you at heightened risk. And then the second thing is to speak to your healthcare provider before you travel, weeks before you travel. And there may
Hmm.
be interventions like vaccines, prophylactic, medications, or
Yes.
even behavioral changes like steps you can take to minimize the risks of being bitten by mosquitoes that may transmit a deadly or dangerous disease like malaria or dengue fever, for example.
Hmm. Yeah.
But I do want to highlight the importance of people actually having travelers' health insurance when they go abroad
Hmm.
outside the
Hmm.
country. And I say this firsthand, just in the last few weeks, I've been working at the hospital and seeing patients, and have just encountered a situation where someone is a traveler coming into the country, did not have travelers' health insurance, and this put an enormous amount of distress on them because of all of the
Oh.
costs of hospitalization at a moment
Hmm.
where they should have been focusing on getting better. So this is
Yes.
something that maybe many of us don't think about, but we need to just be aware that we might get sick while we're outside of the country, and we need to make sure we have all the things in place so that if we need healthcare services or even hospitalization, that we have the appropriate coverage to make sure that we can be treated appropriately.
Hmm. Well, I couldn't have said that better myself, Cameron, and completely agree with you on that score. And because today is Halloween, and I couldn't resist asking you this question, what would you say to rumors about zombies?
Well, I think what I would say is that what I appreciate most about zombies is that they really understand the value of a good brain. And at BlueDot, we are integrating artificial intelligence and human intelligence to raise awareness of infectious disease threats around the world, 24
Mm.
hours a day, 365 days a year, including those threats that may not even be officially reported by governments around the world. And we're using this intelligence to help our customers and our partners, which include governments to global businesses,
Yes.
understand how to mitigate risks from today's threats, but also to anticipate and prepare for the future threats we know we will inevitably face.
Hmm. Well, that's amazing. Cameron, thank you so much for sharing your uh, really fascinating insights and your expertise with us today. Thank you on behalf of all of us at THIA. We really, really appreciate your time. And thanks for being a good sport as well.
It's a real pleasure, and I hope you have a wonderful Halloween.